In our first slide, basically, we compare and contrast the two different forms of lymphatic organs. A primary lymphatic organ basically is found in either the bone marrow or the thymus. And basically, this is where the associated lymph cells or lymphoid organ cells, B cells and T cells, are either made or maturing. Secondary lymphatic organs include lymph nodes, nodules, which obviously are associated with them, and the spleen. And this is basically where the mature T cells, B cells, and or antigen-presenting cells migrate and interact there, basically, and become involved in an associated immune response. First off, let's look at the thymus. And one of the things we're going to see when we deal with lymphatic organs is some structural differences, which we can use to distinguish them. And we can utilize the presence or absence of germinal centers as obviously an indicator of structure. The thymus, being a primary lymphatic organ, is not going to have any germinal centers, but it, like a lymph node, is going to be well structured and basically has distinct cortical and medullary regions. Arguably, the most important area of the thymus is in the area of the cortex, because this is where the immature thymocytes are going to be found, and it is the location of what we call the blood-thymus barrier, where the immature thymocytes are protected from involvement of the immune system. Basically, the thymus itself not only contains a distinct cortical and medullary region, basically its major cell type other than the thymocytes are epithelial reticular cells, Hassel's corpuscles, which are probably degenerative remnants of those epithelial reticular cells that are found in the medulla. We said certainly as a primary lymphatic organ, the thymus lacks germinal centers, and its developing T cells are protected in the cortex by a blood-thymus barrier that consists of capillary endothelium, connective tissue, and underlying basal lamina, and basically the cytoplasm of the adjacent epithelial reticular cells themselves. Basically, the functions of the thymus are, particularly in the area of the cortex, it's a site of T cell maturation where the thymocytes learn to distinguish self from non-self, and only the thymocytes that are tolerant of self-antigens basically are selected and allowed to migrate down to the medulla, basically to pass out of the thymus into secondary lymphatic organs, be the vascular circulation. The self-reactive thymocytes, which basically will be the majority of the thymocytes, die basically through programmed cell death or apoptosis. Lymph node, now being a secondary lymphatic structure, is associated not only with the filtration of lymph containing both afferent and efferent lymphatic blood vessels, but it also has a distinct blood supply that's delivering lymphocytes to it and from it as well. The lymph node, like the thymus, has a distinct cortex and medullary region, and as we'll see, the cortex is further divided into an outer cortex, which is going to be B cell and germinal center rich, and an inner or paracortical region, which as we see is going to be a T cell rich region, and an association medulla. As we already indicated, the outer cortex contains the nodules and the germinal centers. It's populated obviously by B lymphocytes. The inner cortex or paracortex is going to be the T cell rich area of the corresponding lymph node. In a diagram, we can certainly see this, and using some schematic illustrations, what you see again is the area of the outer cortex containing the B cell rich germinal centers, the inner or paracortex being the T cell rich portion of the lymphocyte, of the lymph node, and then finally we see the adjacent medulla where the efferent lymphatic blood vessels and obviously the modified B cells, plasma cells, and so on and so forth are exiting. Note that the flow of lymph through the node goes from cortex to medulla, but obviously the flow of blood is basically all medullary in origin and exit. So note that the paracortex, being the T cell rich region, will be the part of a lymph node that will be smaller in size in patients that develop the DeGeorge syndrome. Basically, this is a pharyngeal pouch 3 defect where the thymus itself is deficient in size and obviously will produce fewer numbers of T cells as a result. In addition, the paracortex region of the lymph node contains dendritic cells as well as high endothelial venules, which are site where the lymph nodes are repopulated. Finally, in order to initiate an immune response, obviously there has to be an interaction basically between a B cell and a T cell and a corresponding antigen-presenting cell or a dendritic cell. And once the antigen-specific B and T cells pair, the B cells begin to divide rapidly, leading to the formation of the germinal center in the outer cortex and the subsequent proliferation and differentiation of subsequent B cells. And obviously dendritic cells and macrophages would be present in this area as well. Finally, let's look at the third of our lymphatic organs, again a secondary lymphatic organ, again a site of generation of immune responses, and this is the spleen. So certainly the spleen is involved in immunologic responses that are presented to it by the blood vascular system, but also a significant part of the spleen is involved in the recognition and removal of defective, misshaped, and or aged red blood cells and platelets. Functionally, the spleen certainly has an extensive blood supply provided by branches of the splenic artery that branch initially in the form of trabecular arteries, give rise to central artery branches, and subsequent branching pattern leading to the trabecular veins that ultimately will drain back into the splenic vein. And fundamentally, the two regions of the spleen are not well separated from one another, meaning that the spleen did not have a well-organized cortex versus a medulla. Rather, it is simply an integrated array of red pulp and white pulp. The white pulp, as the name suggests, consists of areas of B cells and T cells, usually in close association with the central artery. What we refer to as being the periarterial sheath is considered to be the T cell portion of the white pulp. The area of what's called peripheral white pulp contains the germinal centers that are highly populated mainly by B cells. The red pulp consists of what we call splenic cords of Billroth and venous sinusoids, and this, as we've alluded to earlier, is the site where defective red blood cells are filtered out of the bloodstream at this point. And also, this is going to be a site where defective red blood cells, as seen in cases of sickle cell anemia, hereditary spherocytosis, or thalassemia syndromes, are basically delayed in their passage from the open circulation back into the venous sinusoid and phagocytosed by macrophages that are lining these Billroth cords. In a diagram, we can kind of see a schematic illustration of where the regions of red and white pulp are found. Note the proximity to the central artery of the periarterial T cell rich sheath and the adjacent peripheral white pulp also associated in proximity with the central artery. And note interdigitating among that are trabeculae basically of red pulp, largely filling up the balance of the spleen. Now, in terms of vascularization, we know that most of the red pulp receives blood that's in what we call an open circulation, meaning that it's not bound by an endothelium and is basically outside largely the blood vascular system. The closed circulation of the spleen is a minor component of splenic vascular circulation, comprising only 10% of the vasculature. And basically, red blood cells must leave the spleen. In order to leave the spleen from the open circulation, red blood cells must pass through a mesh of reticular fibers and into the splenic sinusoids, basically by passing through a discontinuous basement membrane and a slit between these endothelial cells of that sinusoidal epithelium. And basically these red blood cells must negotiate this slit-like discontinuous basement membrane to leave the open circulation and get back into the venous sinusoids in order to exit from the spleen. The open circulation basically, therefore, allows red blood cells and blood vessels to open directly into the red pulp. And basically this path takes them from a trabecular artery to a central artery through a penicillar arteriole, basically exposing them to the macrophage and sheath capillaries in the red pulp. Closed circulation basically is a direct path, all endothelial line, that simply allows a small percentage of the vasculature of the spleen to pass directly from a penicillar arteriole back into a splenic sinusoid.